They didn't collapse. They didn't rush to the emergency room. They didn't even realize anything was wrong. In each case, the body appeared normal, healthy, functional, but something was already inside, moving, embedding, and waiting. These are real medical cases where parasitic infections went undetected, not because doctors failed, but because the symptoms didn't make sense until it was too late to ignore. The first case involved a fisherman. He ate what he always ate, fresh fish from local waters. There was no illness that night, no stomach pain, no nausea. Weeks later, unexplained symptoms began to appear: fatigue, muscle discomfort, neurological complaints that didn't point to digestion at all. Imaging eventually revealed the cause: tapeworm larvae, not in the intestines but embedded in tissue. This condition, known as larval cystode infection, occurs when tapeworm eggs, not adult worms, enter the body. Instead of staying in the gut, the larvae migrate. They lodge in muscle, brain, or organs and can remain there silently for years. What made this case difficult wasn't rarity, it was timing. By the time symptoms appeared, the exposure event had been forgotten. No one associates a meal eaten weeks ago with pain that appears in the nervous system. Parasites don't always announce themselves. They don't always stay where doctors expect them to be. And when they move beyond the digestive tract, they stop behaving like typical infections. The second case involved a traveler. There was no illness at first, just soreness, muscle pain that seemed to migrate, one leg, then the other, then the back. Doctors suspected strain, inflammation, stress, but the pain didn't stay in one place. Imaging eventually revealed parasites migrating through muscle tissue, alive, mobile, changing position over time. These infections often originate from contaminated food or water, but the entry point is rarely obvious. By the time patients feel discomfort, the organisms have already settled deep within tissue. Parasitic infections are often dismissed early because the symptoms are vague: fatigue, discomfort, pain that doesn't localize. Modern medicine excels at treating clear problems, but delayed infections create patterns that don't follow rules. And when imaging finally reveals the truth, the infection may already be widespread. The third case began with vision changes. No trauma, no redness, no signs of infection, just gradual loss of clarity. Doctors suspected neurological causes, optical strain, age-related conditions. But advanced imaging revealed something unexpected: worms behind the eye, close enough to threaten permanent vision damage. These parasites don't attack suddenly. They settle, they grow slowly, and they damage surrounding tissue without pain. By the time vision changes occur, intervention becomes urgent. Each of these cases followed the same pattern: normal exposure, no immediate illness, delayed symptoms. Unexpected location. The danger wasn't T-severity, it was invisibility. Parasitic infections don't need chaos to survive. They need time, and time is what makes them hardest to detect. These weren't rare accidents. They were delayed discoveries. This channel documents real medical cases where the most dangerous part is how long the body feels normal. If you want to understand how infections hide, migrate, and go unnoticed, this series continues.